Hi, so today we will be starting with this topic, calcifying odontogenic cysts. Calcifying odontogenic cyst basically has this other name, three other names in fact: Gorlin cyst, keratinizing and calcifying epithelial odontogenic cyst, and cystic keratinizing tumor. That is Gorlin cyst, keratinizing calcifying epithelial odontogenic cyst, and cystic keratinizing tumor. Question can be a 5 marker, that is basically explain Gorlin cyst. Like जो क्वेश्चन है वो आपके अदर नेम से उठाया जा सकता है इंस्टेड ऑफ द heading, that is calcifying odontogenic tumor. So it was first described by Gorlin et al. It is an oral analog of pilomatrixoma, that is basically a benign skin condition. It is a skin condition. This skin condition is basically characterized by calcifications. कैल्सिफिकेशंस होती हैं इसमें जो अराइज करती हैं फ्रॉम हेयर फॉलिकल्स, एंड this is the same condition of calcification that is seen in calcifying odontogenic cyst. So one of the main characteristic feature is the ghost cell keratinization in calcifying odontogenic cyst. Ghost cell keratinization. So it is an oral analog of pilomatrixoma. Coming to the definition, it is a heterogeneous group of odontogenic lesions. It is odontogenic, characterized by ghost cell keratinization. Shares histologic features with craniopharyngioma. It can present as a cyst or solid neoplasm. So, one and the only main thing in this definition is the ghost cell keratinization. Very, very important Viva question. Ghost cell keratinization is a characteristic feature of calcifying odontogenic cyst. Done. Coming to this dualistic concept of COC, it can basically be cystic, neoplastic or malignant. We'll come to the classification system that explains us that in 2004 it was classified as neoplasm. But in 2017 it was moved back to cyst categories because it behaved clinically, did not behave clinically like a neoplasm. In earlier times it was considered कि हम इसको neoplasm मानते थे in the older times, but now as in 2017 it has been moved back to the cyst category itself. Coming to the etiology, it is a developmental odontogenic cyst. Pathogenesis is obviously uncertain. So basically ये एक odontogenic cyst है. Because it is odontogenic तो इसकी derivation भी होगी from the parts of the tooth itself. That is dental lamina, odontogenic epithelial remnants, reduced enamel epithelium, gingiva or the bone itself. I hope it is clear. कमिंग टू द क्लिनिकल फीचर्स, बेसिकली ये कॉमन है बोथ मैक्सिला में एंड मैंडिबल में, दोनों में कॉमन है. मोस्ट कॉमन होती है ये एंटीरियर रीजन्स में. इट इज़ मोस्ट कॉमन इन द एंटीरियर रीजन, बोथ मैक्सिला एंड मैंडिबल. Increased rate in incisor and the canine region. It has no gender predilection and an average age of 30 years and presents as a painless swelling. So it is most commonly associated with odontomas, AOTs, ameloblastomas. So it has two types of variants. अब इसके variants दो तरह के होंगे. Obviously intraosseous, so it has two types of variants present, that is first one will be the intraosseous, and second one will be the extraosseous. जो extraosseous है that will be associated with our soft tissues, and intraosseous will be intra and extraosseous. It's obviously clear. Extraosseous means out of the bone, so it will be in soft tissues. Intraosseous means inside the bone. So intraosseous is most common, well-defined, painless swelling and jaw expansion is present. Extraosseous is obviously bone involvement नहीं होती है इसमें gingiva की enlargement होती है, painful gingival swelling. So this here it is the clinical picture. This you can see this swelling. This swelling is basically in the anterior region, incisor and canine region. Like see here. This is you can see this radiograph, not very clear, but still you can appreciate the arc form here. So also you can see the calcification here. I told you na, it mimics which a dermal condition that was associated with calcification. So you can see the calcification right here. Done. This is the clinical picture. It was taken from an article. I'll share the link of the article. Just comment it down and I'll send it to you. So these are the radiographic features. Well-defined unilocular radiolucency root displacement. So here, so see, this is the radiolucency. Well-defined unilocular saucer-shaped radiolucency है. You recognize the saucers that are seen hot dogs जैसे. So this is the saucer-shaped radiolucency that is seen, and this is in the anterior region. Calcifications are also seen in 50% of cases associated with root resorption and tooth displacement. So radiographic feature will be unilocular radiolucency. Then we have is calcification. Calcification होगी तो radio opacity होगी. You have to differentiate it. Okay, saucer shaped radiolucency due to erosion of the cortical bone is seen. Hope the radiograph is also clear. Coming to the histological features. Histological feature में we have is that this is the fibrous cystic wall is present. It has the presence of satellite cyst. Lining है epithelium होती है 4 to 10 cells. Cell thick ameloblastoma like lining होती है. Cuboidal cells are present and stellate reticulum like cells are present. Ghost cells is the key feature of the COC. It is a very very important Viva point. So ghost cells की अब origin कहाँ से होती है? Aberrant keratin formation से, intracellular edema, coagulative necrosis. Just go through these. This is not very important, but if you write it, obviously you gain an edge over in your exam. Similarly, the nature, it basically tends to calcify. Calcification होगी इसमें. Appearance pale, eosinophilic, ballooned, elongated, fused when in groups, indistinct nuclear outline. So what does it looks like? It is a pale, eosinophilic, enlarged and balloon shaped. Elongated होता है, elliptical shape, elongated or elliptical. So lining epithelium में proliferate into calcifications होती हैं. So basically you can see here these are the ghost cells seen along with the, this is the ghost cell seen along with the calcifications. Done. This is the epithelial lining. You can see here epithelial lining. It has the presence of ghost cells and the calcifications. Coming on to the treatment. Treatment of choice basically depends. Treatment of choice is enucleation. अब अगर ये COC occurs as a single entity तो हम उसकी enucleation कर देंगे. But if it occurs as a part of some syndrome, as in seen along with AOT or any other complex syndrome, तो हम उसमें क्या करेंगे? Cause को treat करेंगे. So low recurrence rate, prognosis really good, enucleation. So rare malignant transformation होती है, ghost cells present होते हैं. Complications will be malignant transformation, ghost cell odontogenic carcinoma. It's very very rare case. Very rare. It does not occur. So this is one of the things that you have to keep in mind for COC. That is basically COC. Coming on, one of the important things that you have to keep in mind for COC. It is also known as Gorlin Cyst. It is common in the anterior region, equal in males and females, anterior में incisor and canine region में. Coming to the radiographs, saucer-shaped radiolucency and calcifications. Along with calcifications are seen. I think you should note it down. Also for histopath, there is a characteristic features called as ghost cells. अब I have also seen in some university exams that ghost cells come as a single entity question. तो इसमें से 2 questions बनेंगे. First will be the Gorlin cyst और second will be the ghost cell. Done. These both can be your 5 marker questions. I hope this topic is very very clear to you. You can just comment down for the notes of this chapter or any of the doubt that you did not understand. Like, share, subscribe. Thank you so much.